The layer of your eye where the light comes and falls is called the retina. The central part of that is required for the sharpest vision is called macula. And in that macula, when you have some deposits that come over time with age, that condition is called age-related macular degeneration. There are also some hereditary macular degenerations that come due to genetic diseases, but most commonly what we see are the age-related macular degenerations. So age-related macular degeneration is of two types. One type when there is no fluid into the retina, which is called dry age-related macular degeneration. And the other type when there is new blood vessels and then fluid comes into your retina, that is called wet age-related macular degeneration or choroidal neovascular membrane. In dry ARMD, there are age-related deposits in your retina which cause gradual decrease in vision. Because they affect the macula or the area that is needed for the sharpest vision, your first symptom will be difficulty to read small letters even with your glasses on. However, if you have dry AMD changes, in the beginning you may not have any symptoms at all, and also if you have dry AMD changes that are increasing in one eye and not so much in the other eye, you may not recognize that you have a decrease in vision because your other eye will be reading very well. But decrease in near vision is the most common symptom of dry AMD. Sometimes you may also get missing letters where when you are reading a sentence you are not able to read a few letters. This happens in the later stages of dry AMD when there is a significant amount of atrophy that has set into your retina. Unfortunately, age-related macular degeneration is the name. So the commonest risk factor and the most important risk factor is increasing age, which is what we call a non-modifiable risk factor. So you cannot prevent yourself from aging. So some of these people can develop age-related macular degeneration. However, some of the known modifiable risk factors are, one is obesity and the other is smoking. So if you can reduce these or stop this, especially smoking, you can prevent dry AMD from occurring and dry AMD from progressing. When there is early dry ARMD, what treatment is given is usually better powered glasses for you to see more clearly, as well as some antioxidant tablets. So we have various studies that have been done that has told us the exact combination of antioxidants that you require for macular health, and if you take it in the right combination, you can prevent progression of your dry AMD. However, once it has reached the stage of atrophy where there is a gross decrease in your near vision, you may require what we call magnifying glasses or low vision aids to help you to lead a normal life. Unlike dry age-related macular degeneration, wet degeneration produces a sudden decrease in vision, especially in your reading vision. This can present as a black area in the central part of your vision. When you are looking at somebody's face, you may find the nose and mouth area are darkened, or when you look at the paper, you will find that some areas you cannot see. It can also present with what is called metamorphopsia or change in the shape of lines. This is commonly seen when you look at window bars, you will find that there is a small bending that can happen. Sometimes you can get missing letters because of the fluid in the retina, because of the wet AMD. You may get that the letters are widely spaced together or the letters are crowded together. So these are the usual symptoms of wet AMD. If a person who has dry AMD is converting to wet AMD, that also will be seen as these symptoms. So if a dry AMD person suddenly gets these symptoms in one eye, they should suspect that there is conversion to wet AMD, which requires more and immediate treatment. In wet ARMD, once it is diagnosed, we do some tests to be sure that we are dealing with wet ARMD. The usual tests that are done are an optical coherence tomography or a scan of your retina, and also sometimes an angiography. Now, angiography for wet AMD can be a scan related angiography called OCT angiography. Here there is no dye that is injected. Or sometimes the doctor may recommend that you have a dye injected angiography called a fluorescein angiography, or an ICG angiography in which a different type of dye is injected. This in many combinations are needed for you to diagnose that there is wet AMD. Once the diagnosis is made, the treatment is usually intravitreal injections, in which we give injections of monoclonal antibodies against VEGF, which cause these abnormal blood vessels that are growing under your retina to die off or regress, and these injections will be required at monthly intervals till the neovascularization or the new blood vessel completely regresses. Unfortunately, all the anti-VEGF antibodies that we have currently have a limited duration of action. So they remain inside this vitreous jelly only for about 4 to 6 weeks. And because of that, the recommendation is that in the initial first 3 months, you require what is called a loading dose. So every month you will require these intravitreal injections to keep your neovascularization under suppression. After that, depending on how fast your neovascularization is regressing or how fast your disease is responding, your doctor may recommend extending the period between the injections or waiting and watching whether it is coming back and then giving you a repeat injections. In this disease, what needs to be understood is that with 1 or 2 injections, this condition cannot be completely controlled. So irrespective of the type of injection that you are taking, you will require repeated injections till we are absolutely sure that the disease is not coming back. In wet ARMD, if you allow some time to pass, say you've got a defective vision 1 month back, you have not shown anyone, you have not taken any treatment, or you did not even know there was defective vision because, like I said, when you have good vision in one eye, you may not recognize that the other eye has defective vision. So many patients present to the doctor really late. And once it has reached the doctor really late, when something called scarring has set in, when you have a wound on your hand, when it heals, you have a mark there, no, that is called a scar. Similarly, you can get retinal scarring in wet AMD, and that retinal scarring, once it has set in, it limits the amount of vision that you are getting back. Invariably, when we treat wet ARMD, there will be some amount of scarring, but if the scarring is very small and limited, you will regain more vision. If the scarring is very extensive, you will not regain that much vision. So those are the limitations of treatment in wet AMD. Since age is a non-modifiable risk factor, to a large extent we cannot prevent AMD, but you can by leading a healthy lifestyle, avoiding smoking, avoiding excess weight gain and getting good exercise, and also using some form of antioxidants once you have crossed the senile age group, so that you do not get these age-related diseases. All patients after the age of 50 require a yearly retinal examination. What is also important is that the moment you have some decrease in near vision, without attributing it to cataract or thinking that it may be something else, it is always better to get a full retinal examination. Only by examining your retina can the ophthalmologist tell you whether you have the beginnings of age-related macular degeneration. If you have been diagnosed to have early macular degeneration, it is very important for you to do self-monitoring. So we advise self-monitoring means you have to wear your glasses and you can look at either small print or you can look at a particular grid that is provided to you called the Amsler grid with one eye. So each eye has to be closed separately, and at least weekly or once in 2 weeks look at this grid with each eye separately and see if you are not seeing any part of the grid or if there is any black area or any bending of the lines of the grid. If you do not have the grid with you, a simple way of doing it is to look at small print in the newspaper and to look at window bars. If you find any bending of the window bars, you should immediately report to your doctor. If you do not do this one eye separately, you may completely miss out that one of your eyes has progressed with AMD, either dry AMD progression or conversion to wet AMD.